Welcome to the Mid-America PTTC podcast, where we are a community of change leaders and prevention catalysts that strive to empower individuals and communities to promote safe, healthy, and drug-free communities across our region. We're honored to have you as a member of our PTTC community. Thanks for listening and keep up the great work.
Every single one of us is a leader and could be a leader.
It started with a local coalition in our county.
Strategies you know, but stories you don't.
Data is the currency of prevention.
We want to reduce the negative and we want to promote the positive.
Collaboration is the only way to move the prevention needle.
About connecting the research with the practitioner.
Put something out there that was kind of off the wall and create a community of prevention.
It's a passion, it's a real love to try to help make our world a little bit better, a little bit happier, small pieces at a time.
It's said an overnight success takes 16 years.
If we didn't plan for the change, but if we didn't help orchestrate it, then change is going to be upon us.
When it comes to the spiff, slow is smooth and smooth is fast, because the real power is in the process.
Ultimately, all of us want success in the work we're doing. We don't want to do mindless work. Proactive, participatory planning promotes positive, preventive progress.
This is the Mid-America PTTC podcast. I'm your host, Dave Clausen, and I'm the director of the Mid-America Prevention Technology Transfer Center. This is episode 22, and today we'll be talking with Nicole Augustine. Nicole is the project coordinator for the Southeast Prevention Technology Transfer Center at Wake Forest University School of Medicine. She's been working in the field of prevention since 2001. Nicole has a Master's of Public Health degree from the George Washington University School of Public Health. She is a passionate prevention provider and committed to supporting initiatives designed to address the complex substance use issues affecting our society. In today's episode, Nicole is going to share her expertise on the Prevention Specialist credential, the 6 domains under that credential, and she'll outline and unpack some of the benefits to becoming credentialed. Before we get into the content, we'd like to thank our funder, the Substance Abuse and Mental Health Services Administration. And a quick note, although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. Without further ado, let's get into today's episode. Okay, and I would like to welcome Nicole to the podcast. Hey, Nicole, thanks for joining us.
Yes. Hi, Dave. How are you today?
Doing wonderful, doing wonderful. It's a snowy day here in the Midwest, but we're doing just fine. Now,
Awesome.
glad you could join us today. And for the audience in our Mid-America PTTC region, would you mind sharing just a little bit about yourself or your PTTC region, please?
Sure. So my name is Nicole Augustine. I am the project coordinator for the Southeast PTTC, which is considered Region 4. And I've been in prevention now for quite a while. I actually started in sexual health prevention, then transitioned into substance misuse prevention with college students. And so most recently, I've had the pleasure and honor of working with the PTTC of really looking at the workforce development needs for our field in prevention. So it's just really, really exciting to have a whole network really trying to make sure that our prevention workforce is ready to meet all of the unique demands that are happening in our society related to substance misuse.
I get just excited almost every week seeing the true benefit and power of having such a great network, to be able to connect with experts from across the country. When I first started in prevention, I was a small university, and I didn't have access really to a big network, didn't know who to call to get some support or help. And so I'm a big fan of the PTTC network, and not just because I work there, but it's powerful.
No, I would have loved to have something like this in my younger days, So it's really, really exciting to have this kind of resource now.
Very much so. And for those listening, each PTTC region had to select a focus area or priority area. For example, our Mid America region is drug endangered children. Now, the Southeast PTTC happens to be focusing on prevention specialist credentialing, which brings us to our conversation today.
Yes, that's right.
Real quick lay of the land for our region. So we've got 4 states in the Mid-America region, and each one is in a little different spot when it comes to prevention specialist certification or credentialing. We have one state that's exploring the potential to implement a prevention specialist credential. Another state's been sort of longstanding. They've got a good, robust credentialing system in place, whereas another state is they'd like to really bolster it and let the prevention workforce know, like, hey, there are some benefits to certification. There really are. We want to encourage folks to go through the certification process. So I was hoping you could share some of your knowledge and expertise when it comes to certification. So could we just start with, how would you describe, or what is certification for prevention specialists?
Sure. So the prevention specialist is actually the name of the certification that actually comes from our credentialing body called IC and RC, which stands for International Certification and Reciprocity Consortium. It's a total mouthful. But essentially that was started in 1981, and they are who have developed our standards and provide the examination that anybody who is certified as a prevention specialist takes the exact same exam. So this particular credentialing body is responsible for that. And like you said, just like you've said in Mid-America, in the Southeast, we have the same sort of thing, that the states have different requirements. Now, there are basic requirements of what it means to become certified. So what I mean by states have a different requirements in that not all states require someone to be certified in order to practice prevention. Okay. And that's where the inconsistency, I'd say, would be across the country in general. Is some states have it as a base requirement. If you're going to be doing prevention education, you've got to be certified. And other states, take a more laissez-faire approach to what's required. So that would really kind of describe our landscape here when it comes to prevention and the certification that's needed to kind of do prevention work in the field.
I imagine that landscape is similar in all of our other regions as well.
It absolutely is, yeah.
I plan to share this podcast with just about everybody.
Yeah, I would say it's an issue across the board. Prevention has historically been a field that wasn't really based upon educational requirements or those sorts of things. And so because of that, there's a lot of inconsistency across the country. There's some states that have really stepped up to the plate and made it a mandate that, we prioritize credentialing. And actually, according to ICNRC, there are 5 states that really prioritize credentialing. It's Ohio, Texas, New York, Michigan, and Oregon. They're kind of like the top 5 states for credentialing. The other states is a little bit hit and miss, And my whole perspective is credentialing gives us credibility. So we as a field should be advocating for all of our folks to be credentialed.
Yes, we'll jump into some of those benefits, but could we sort of walk through just briefly the domains that fall under credentialing?
That's right. Yes, so there are actually 6 prevention performance domains that were created. And these domains are the basis of what's used to create the test. So the first domain focuses on planning and evaluation. And as you can imagine, the title, it focuses on the big pieces of what's involved in planning a community program, how do you evaluate a program. Domain 2 focuses on the prevention, education, and service delivery component. And what's interesting is when you think about the history of prevention, so much of our work has just been historically prevention, education, and service delivery. But this is actually just a small domain, small piece of the whole pie, if you will, of what makes up a prevention specialist. This focuses on things like maintaining fidelity and adaptations and how do you deliver services, but it's not, what I do like about the domains is it stretches us beyond just doing programming in schools.
Mm-hmm. Mm-hmm.
Then there's domain 3 that focuses on communication. And historically, folks may not know this, folks who are new to credentialing, historically communication actually wasn't its own domain. There used to only be 5. And probably about 4 or 5 years ago, they decided to pull communication out and make it its own domain, which makes complete sense. If you think about it, Dave, everything we do in prevention is talking.
Mm-hmm. Yes.
Like so much of the work we do is about communicating a message to someone, whether we're in a classroom or doing environmental strategies, social media, advocacy. All of this is built around communication. So I was really, really excited to see them pull this out as its own domain, of really encouraging that the basis of what we do is having effective communication skills.
I love that. I love that. It actually reminds me of a quote that I was putting together for my social media.
Mm-hmm.
Communicating is a skill. We do it every day. But when do we take time to really learn and improve that skill?
Yeah, I know.
You got to practice. You got to practice if it's a skill.
You absolutely have to.
Okay, sorry about that sidebar.
No. For me, I could spend all day talking about communication, just because if you think about it, so much of our work is dependent upon it. And being successful is dependent upon it too. And I'm like you, I don't think we spend enough time thinking about facilitation skills, presentation skills, right? Mm-hmm. Because we've all sat in trainings where the presenter got in the way of the message.
Mm-hmm. Mm-hmm.
Yeah. I have a love for communication like you do. So.
Oh, wonderful. All right. Well, try not to get too.
Okay. Well, yes. I know. So domain 4 focuses on community organization, which is where our work with coalitions really comes into play. Knowledge of working with stakeholders, understanding sustainability, creating strategic alliances, all of this is a part of that particular domain. Mm-hmm. Mm-hmm. And then the 5th one focuses on public policy and environmental change. And I would say domain 4 and 5 kind of go together, the community organization, but also public policy, environmental change. There's a lot of overlap there. Mm-hmm. But this particular domain really looks at our knowledge on advocacy, what is environmental change, how do we support policy change, and those sorts of things. Mm-hmm. And then the last domain is called professional growth and responsibility. And this is the domain that really gets you thinking about things like, what is prevention ethics? What are you doing for your own personal health and wellness, right? Mm-hmm. And how do you support and advocate for health promotion in your community? Yes. So those are the 6 domains. And when you think about all 6 of them, it really creates a very well-rounded professional, someone who understands how to plan programming, deliver them, communicate effectively, organize a community, also, develop environmental change and policy change, right? But then operate from an ethical place. So it makes a really, really well-rounded professional. And that's why, for me, I'm a huge advocate of credentialing, because in order to pass the test, you have to be knowledgeable about all these 6 domains. Mm-hmm. So there's, background and studying that goes into place that help you pass the exam.
Well-rounded professional, which will help folks implement a comprehensive prevention plan. Yes. Comprehensive.
Right.
Yes.
Comprehensive. Yes.
I like it. And I also sort of personally made my heart happy when you shared the professional growth and responsibility domain, that work-life balance. And to me,
Yes.
it's, are we living by example and leading by example also?
Exactly.
Yes. Oh, I like it.
Yep.
I like it.
Such a critical part too. Yeah. Such a critical part.
Self-care. I'm going to a little sidebar rant for those listening.
Yeah.
You care about your communities. You care about those individuals, those families. And I feel like we as prevention specialists, prevention practitioners, because we care, we keep our head down and we work and we work and we work. And then we get a little bit of fatigue. We get burnt out, overworked. So I always like to say, take time, pick your head up, and look how far you've come, and celebrate all of the work that you have done. You may not have reached that, quote, finish line, but stop and pat yourselves on the back, because self-care is important, and you all are doing great work. So keep it going.
Absolutely. Absolutely.
Okay, end rant. So, well-rounded prevention specialists built around those domains. What are some of the benefits that, becoming a credentialed prevention specialist kind of bring to the table?
Sure. I would say there's a few benefits. One is the fact that it establishes credibility. If you think about any other profession, a doctor, a therapist, right? We look for credentials, because that's what lets you know that this is someone who has studied, who has, put in effort to be at the place that they're at. And by having a credential attached to the work we do, we're giving ourselves credibility, and it verifies competency, right? So if someone hires a prevention specialist, it lets them know that this is the type of competent professional I'm going to get. I also see the benefit as it's a great marketing tool. When you are an individual, it enhances your resume, enhances your reputation in the field. If you are an agency that hires or, promotes or advocates for certification, it allows that to be a marketing tool for yourself to say, hey, we have certified prevention specialists delivering our programming and helping you and being consultants on community projects. Now, specifically with the prevention specialist certification, the really cool thing is that there's reciprocity. Some folks may not know this, but I believe, there are at least 48 states and territories have boards. And there are 11 boards internationally. So the really cool thing is if you become certified as a prevention specialist, you can go international, you can travel to another state, and there's reciprocity there. You get certified in one state, all you have to do is contact the new board in your new location, and there you reap all the benefits of being a certified professional.
That is definitely a benefit that I'd never thought about.
Right. Yeah, because we live in a day and age where people move all the time now.
Yes,
We're
indeed.
so much more of a mobile society, and it's nice to know that you've put in time and work to get a credential that if you travel to and move to another place, to know that, you can take your credentials with you, just like a nurse would, just like a doctor would, or a lawyer,
When you mentioned competency, it shows that you're competent. You're very competent in the field and skills, which for those that might not have listened to a previous podcast episode for us, we talked about the pyramid of success: competent, confidence, and commitment. And I feel as though we in prevention, we are committed. We care so much. And then as you develop your competence through becoming credentialed, that will also build your confidence. They work together. So if you want, go back and listen to that episode and learn a little bit more about the pyramid of success. All right, another little sidebar. But yes, indeed, that competence drives so much more too. What are some other sort of reasons folks should look to become certified?
I think the main thing that I also think about is there's a difference in The best way I can say it, Dave, is there's a difference in pay when it comes to prevention and treatment.
Mm-hmm.
Okay.
Mm-hmm.
That's the easiest way to say it. And I think some of it comes from, the fact that in the treatment field, there are standards around education requirements, credentialing, license, and those standards, because of those standards are in place, that particular field has really been able to advocate for strong pay, but also funding too. And so there's a part of me that wonders if prevention kind of always gets the short end of the stick. Some because historically we haven't been thought of as a legitimate field. And I think some people don't realize there's actually prevention science and prevention research. The curriculums and the programs folks are using, those aren't just pulled out of thin air. And to me, a focus on getting more folks credentialed is a part of bringing credibility to our field. So one, we can command higher pay as professionals, but also our fields can command higher pay. I think there's always this kind of back and forth really about where we put money and where we put our resources. And, for those of us in prevention, we know that prevention works. Mm-hmm. It's the only way we are able to slow down, the issues and the new people becoming substance users and having a substance use disorder. Prevention is the only way to do that. Treatment, treatment is awesome. We need treatment. But the truth is, treatment only affects those who are already who've crossed over into a substance use disorder. So how do we work together to really create community change, improve the health and wellness of our society? And it means focusing on prevention. And to me, that means we have to have a competent workforce to then go do the work of prevention so we can actually create community change. The whole thing is getting to community change. If you're knowledgeable about what it really takes to develop a community program, what it really takes to create environmental change, then you're more effective in the field. So for me, credentialing is connected and tied to kind of improving the effectiveness of our prevention strategies.
Mm-hmm. One little related sidebar. It's the holiday time, and I don't know about you, but having family meals together and trying to explain what I do for a living, folks are like, prevention?
Yes.
What are you talking? What is what?
My family still doesn't know what I do.
Yes, and so I'm glad, showing like there is a lot of science behind what we do. I think that's important, and yes, certification can help build that brand, that knowledge of what prevention really is. Absolutely.
Yeah.
I'm glad you brought that up. Yeah, I had to share that little tidbit since it is a holiday time.
Yes.
Wonderful. Where can folks go to get more information about prevention specialist credentialing?
Sure. Well, the Southeast PTTC is actually hosting a webinar in a few days on Wednesday, December 18th at 12:30 Eastern Time. And so I'll actually be doing an hour webinar to really kind of dive a little bit deeper in some of the things we've been talking about here today on what it takes to become certified. Now, my presentation will be focused primarily on the Southeast region, but the information, the content can be applied because some of the things are standard, like the prevention domains are standard no matter where you are. So there's an option for folks to be on the live webinar. Now, we do always record our webinar, so if folks can't attend, it will be recorded and archived, and that's just simply going to the PTTC network website and then looking for the Southeast PTTC specific page. So folks will be able to get information there. The other plug I would say is there's always, I mentioned earlier, IC and RC. They have a website, and that website will link you to all of the credentialing boards, no matter where you live in the U.S. And that's internationalcredentialing.org. And so folks can always visit that website, and it'll give them links to their board in their state and who to reach out to. And that way they can find out what are the requirements for their particular state to become certified.
Awesome. Awesome. Well, I will put a link to both ICNRC's website and your webinar registration
Yes,
webpage. And it's
yeah,
a
we'd be
free,
happy to have folks on there.
and it's a free webinar, of course.
That's right. It's free.
And I'm assuming folks will be able to ask questions at a couple points as well.
That's right. So we do have the webinar set up. Even though it's an hour, I'll only take maybe like 40 minutes of like actually talk, and then we'll leave the last 15 minutes of the webinar open for folks to ask questions.
Great, great. I always learn a lot from those questions. And there's been a few times too that through those questions, I've ended up reaching out to somebody that was also attending the webinar to help connect and support each other, because we are all in this together. Great.
That is so true.
And for those folks listening, if you're in the Mid-America region, reach out to me, or if you're in the Southeast region, reach out to Nicole, or if you're in a different region, reach out to me anyways, and I'll connect you with a person you need to talk to. That's the benefits of a network.
That is the truth.
Well, this has been a pleasure. It was great talking through those domains and really diving into the benefits of certification, and the fun little sidebar about nobody knows what we do in prevention.
Right. Well, it was a pleasure talking with you too also, Dave. Thank you so much for doing this today.
Oh, thank you very much, and happy holidays.
Okay, happy holidays to you also.